Hello everyone, welcome back to my channel. Today we will be learning about NSAIDs, which is Non-Steroidal Anti-Inflammatory Drugs. These are among the most widely used medicine in the world. And in this video I will explain their classification, mechanism of action, uses and side effects in a simple way. So let's get started. Introduction. NSAIDs are very commonly prescribed drugs. They mainly have three important actions. Analgesic, meaning they relieve pain. Antipyretic, meaning they reduce fever. And anti-inflammatory, meaning they reduce swelling. That's why they are widely used in arthritis, fever, pain and other inflammatory conditions. Next, mechanism of action. Now, how do NSAIDs work? They act on arachidonic acids pathway. Normally, phospholipids from the cell membrane releasing arachidonic acid. This is converted by COX enzymes, that is cyclooxygenase, into prostaglandins and thromboxanes. Prostaglandins are responsible for pain, fever and inflammation. So when NSAIDs inhibit COX enzymes, they block prostaglandin formation and that gives relief. Next, types of COX enzymes. There are two main COX enzymes, COX-1 and COX-2. COX-1 maintain gastric mucosa, renal blood flow, platelet function. COX-2 induce during inflammation, causes pain and fever. Different NSAIDs target COX-1 and COX-2 or sometimes both. Classification of NSAIDs. NSAIDs can be classified into four groups. Number 1, preferential COX-2 inhibitors, selective COX-2 inhibitors, non-selective COX inhibitors, and last one is analgesic antipyretics with poor anti-inflammatory action. Next point, preferential COX-2 inhibitors. Example include nimesulide, diclofenac, aceclofenac, meloxicam, etodolac. Next, selective COX-2 inhibitors. Example include celecoxib, etoricoxib and parecoxib. Okay. Next, non-selective COX inhibitors. Example include salicylates. Salicylate, example aspirin. Propionic acid derivatives, which also example ibuprofen, naproxen, ketoprofen, fluorobiprofen. Next, phenamate, mefenamic acid. Next, enolic acid derivatives, pyroxicam, tenoxicam. Next, acetic acid derivatives, ketorolac, indomethacin, nebumetone. Next, pyrazolone derivatives, phenylbutazone, oxyphenobutazone, propionazone. Next, analgesic antipyretics with poor anti-inflammatory action. Example include para-aminophenol derivative. Example paracetamol, which is also called acetaminophen. And benzoxazosine derivative. Example nifopam. Next, clinical uses of NSAIDs. Example pain relief like headache, toothache and muscle pain. Treatment of fever, which is reduced fever, treating inflammation in arthritis, gout and spondylitis, postoperative pain management. Specially, aspirin is used for its antiplatelet effect to prevent heart attack and stroke. Adverse effects. However, these drugs are not free from side effects. They can cause gastric irritation, ulcer, and bleeding because of COX-1 inhibition. Long-term use may damage the kidneys also. Selective COX-2 inhibitors may increase cardiovascular risk. Some people may also develop hypersensitivity reaction. To summarize, NSAIDs are common drugs used for pain, fever, and inflammation. They act by inhibiting COX enzyme and reducing prostaglandins. Different classes target COX-1, COX-2, or sometimes both. While effective, they must be used carefully due to possible side effects. That's all for today's videos on NSAIDs classification and uses. I hope this presentation made the topic clear for you. If you found it helpful, don't forget to like, share and subscribe to my channel for more medical and pharmacological content. Thank you for watching.